Dr. Lenore Coleman, president and founder of Healing Our Village. And for all of you out there that are joining us via Zoom or via our Village Talk radio show or our hovhealth.com live event, welcome. These are programs that we will be doing every Saturday from 11 o'clock to 1 o'clock, and we're going to cover our health education programming for various physician groups like Gerald Family Care and others. On the second and third Saturdays, we'll be doing Sugar Busters, part 1 and part 2. But on the other Saturdays, we're going to bring in a variety of different topics, and we'll let you know via our Facebook page or via emails that we're going to send out to you. Or you can always go to the healingourvillage.com or hovhealth.com, and we'll have sort of the calendar up there for you to look at, to know and what to expect in terms of our education programming. I really want you all to send this out to your family, your friends, to your people in your community, your folks that go to your church, because we have a huge number of people in this country that have diabetes. And sadly, there is a prevalence of diabetes in African American communities and Latino communities. What do I mean by prevalence? What I'm saying is their risk of getting diabetes, type 2 diabetes specifically, is 2 to 5 times higher than their Caucasian counterparts. And so this is really an epidemic. And if you're coming in from some of my Caribbean areas like Jamaica, Barbados, Caymans, all of you folks, hey, how you doing? Bahamas, welcome today also for our program. And in your countries that you have a lot of diabetes. And then I got my African countries coming in also. We got Nigeria, we got Ghana, we got many of the other countries in Africa. You don't even know what your prevalence is because they're not really capturing the data like they should. So these programs on Saturday are for the diaspora, for the entire African diaspora, anywhere where the boat left and where the boat landed. That's what I'm trying to do with this educational program. So I'm trying to get to millions of people viewing this content so that we can try to decrease the prevalence, decrease the complications of diabetes. That's what this is all about for me. So again, welcome to Sugar Busters. This is part 1, and we're just going to really go over what diabetes is and the symptoms and that you should be watching out for. If you have diabetes in your family, folks, right now you need to go to your local pharmacy, buy a blood glucose meter, and start testing. Because many of you out there may have pre-diabetes, which we'll talk about, but many of you may already have diabetes. We know that about 8 million folks out there don't even know that they have diabetes. And we're going to talk more about that as we go on. So let's go ahead and just kind of jump in and get started. In our series called Sugar Busters, what we're going to cover is an overview of diabetes. We're going to talk about monitoring your blood sugar at home. So important. If you don't have a meter, you need to get one. If you don't have health insurance to cover the price of your meter, you need to go on to Healing Our Village, hovhealth.com. We have a store. We have a low-cost meter there, which is much less expensive, and it's accurate. There's a lot of meters on the market, but not all of them are accurate. So the ones that we sell have been tested. We know their accuracy. Everyone with diabetes, everyone with prediabetes need to be monitoring, and we're going to talk about why that is. We're also going to talk a little bit about sick day management and long-term complications. So this is actually going to be a 3-part series. We're going to break it up because of Zoom. What we used to do back in the good old days, we just have 2 weekend classes that were 3 hours long. And so in 6 hours, we were able to cover everything. But now that we have to break this up into bite-sized pieces because we're on either social media or Zoom, we're going to have to sort of move this out to a little bit longer time period. So again, exactly what is diabetes? Well, we know that in terms of who has it, about 30.3 million people in the United States. We know that 21 million know that they have it. And then there's about 8 million, as I mentioned, that are walking around every day, have no clue that they have diabetes. And that's not okay. Because if your blood sugars are high and you're not doing anything about it, it causes damage. It causes damage to your eyes, to your kidneys, to your heart, to your blood vessels. And so we need to make sure that all of you, especially if you have a family history, know what your blood sugar is. Now, who might get diabetes is another question. And that is that pre-diabetes that I mentioned. So there's another 86 million people in the United States who have pre-diabetes. This means they haven't quite got to that magic number of 126 milligrams per deciliter where we diagnose diabetes, but they're not down in the normal range of 60 to 100 milligrams per deciliter. So they're in that range of about 101 to 125 milligrams per deciliter, and they have what we call prediabetes. Now, Healing Our Village is a certified diabetes education program for those who have diabetes, but we're also an accredited CDC program for those who have prediabetes. So we're going to have content, education, programming for you that fall into either one of those two categories. Now, when you talk about African Americans, it's about 4.9 million African Americans that have diabetes. And, I think at this point, because that's the data is about 2 or 3 years old, we're probably up to 6 million or more African Americans in this country that have diabetes. We know that 18.9% of African Americans greater than 20 years old have been diagnosed or undiagnosed diabetes. We know that diabetes is 2 times more common in African Americans than it is in Caucasians. We know that 25% of those African Americans that are in that age group of 65 to 74 have diabetes. So when they've been talking about COVID-19, when they've been talking about the increase in prevalence of COVID-19 infections in African Americans in the United States, it's because of that age group of 65 to 74, 25% of them have diabetes. And by the way, their diabetes is not under good control. And that is why I'm coming to you today. It's because we no more excuses, folks. It's time to get our blood sugars under good control. And we here at Healing Our Village can help you do that. We know that 1 in 4 African American women over the age of 55 have diabetes. Now, there's a whole group of folks who are at risk of getting diabetes just because of who they are. So we know that those folks that have a family history, if your parents or your grandparents, your aunts, your uncles, if those folks in your direct family tree have diabetes, especially your parents, your brothers, your sisters, that puts you at increased risk. If you have a family background, an ethnic background, where you're either African American or Native American or Hispanic, Asian American, Pacific Islanders, all of those folks have an increased risk of getting type 2 diabetes. We actually know that for every decade of life, your blood sugar goes up. So age is a risk factor for diabetes. We also know that if you are overweight, which is defined as a BMI of 30 or greater, or if you're obese, which is defined as a body mass index or BMI of 35 or greater, then those folks have an increased prevalence of diabetes. And we're going to talk about why that is as we continue with the program. And we know that high blood pressure, or people who are on high blood pressure medications, we find that those folks that have hypertension or high blood pressure are at increased risk of getting diabetes. In fact, a lot of times, the first thing you see is the high blood pressure, because diabetes basically is a cardiovascular disease. Diabetes affects the heart. It affects the blood vessels. And so many times, the first signs of you getting diabetes later on might be high blood pressure. We know that folks with diabetes have high cholesterol levels, that they have a history of heart disease in their family. They may be in that range of pre-diabetes. So their blood sugars are already starting to trend upward. And there was a big study called the Diabetes Prevention Program that was done by the NIH. In that study, they found that people in the category of pre-diabetes, about a third of them go on to develop diabetes. So it's a risk factor. And then if you have an inactive lifestyle, if you're sitting on the couch, especially during this last 6 months, I've talked to so many people, everybody's struggling with that 5, 10 pounds that they just gained during this COVID-19 epidemic because you're forced to stay at home. That inactive lifestyle is also a risk factor for diabetes. Now, if you're a woman, just by virtue of being a woman, you may be predisposed to polycystic ovarian syndrome, or if you've had gestational diabetes, which meant you had diabetes during your pregnancy, but then when your pregnancy went away, your blood sugar came back down to normal. People that have had gestational diabetes are also at an increased risk of developing diabetes later on in life. Now, what exactly is diabetes? Well, it is a disease that affects the body's ability to produce insulin or respond to insulin. So it's a disease where the blood glucose, and people sometimes call that blood sugar, where the blood glucose actually is higher than normal. So now this is the way this works. So when you eat food, that food that you eat in your meals and your snacks is actually broken down by the body. And that food is what provides fuel to the cells of the body. Now, when you eat that food, it's broken down into either carbohydrates, which are sugars and starches, fats, or proteins. And that happens actually in the stomach. Now, the sugars and starches is what we worry about. That is what we have to really watch if we have diabetes or prediabetes, because those sugars and starches that you're ingesting in your diet, that is what turns into glucose. And then glucose or blood sugar is absorbed very quickly out of the blood, and it is the main fuel that fuels the cells of your body, your heart cells, your brain cells. And sometimes when you get a low blood sugar reaction, it's hard for you to concentrate. It's hard for you to think. That's because the brain cells are being deprived of glucose. So glucose is definitely important for your body to function. We just don't want that glucose to get too high. Now, insulin. Insulin is really important in this equation because insulin is what helps get the sugar out of the blood into the cells. And we're going to talk about that. So the question, though, is where does insulin come from? And it comes from the pancreas. So the pancreas is a large, elongated gland that's located actually behind the stomach, and it secretes this hormone called insulin throughout the day after you eat. So insulin actually, think of it as a key, and your cells have a door in it that has a lock on it. And so this key, the insulin, goes in and unlocks the doors of your cells in order to allow that sugar, the glucose, to get out of the bloodstream inside the cells so that the cells can function. So it is insulin that is the key that opens the cells so the blood sugar gets inside. And the purpose of insulin is to help that glucose move from the blood into the cell. So this little cartoon that you see on the slide is a really easy cartoon for you to understand. So you see that key, opening up that door, and now that blood goes inside and is carrying glucose in the blood. Now, there are two different types of diabetes. There are type 1 diabetes, where the pancreas makes little or no insulin. So that means there are no keys available to open up the cell. So that is why the folks with type 1 diabetes have to use insulin injections, because they don't have any insulin in their bloodstream to be able to open up those doors. That represents about 5% of the population, 5-10% of the population of diabetes. The other type, type 2 diabetes, represents 90% of the folks with diabetes. And that means that the pancreas either makes too little insulin or not enough insulin, or that the insulin that is made, the key doesn't fit the lock. So it doesn't work to open up your cells to get the blood sugar in. Now, the interesting thing is that most people with type 2 diabetes fall in that category. They got plenty of insulin. In fact, they have a lot of circulating insulin in their bloodstream. And having high concentrations of insulin in your bloodstream is not good for the body. So this is what most people with type 2 diabetes have. And so we try to do things to decrease those high levels of insulin in the blood. And how do you do that? You do that through watching what you eat and also getting exercise. And we're going to talk about that. So we know that people with diabetes have something called hyperglycemia. That is the name for high blood sugar, okay? And there are certain signs and symptoms of high blood sugar. And these symptoms are frequent urination, especially at night. All of a sudden you get really thirsty, you just can't get enough water. You can sometimes, if it goes on for a long time and your blood sugars get high enough, you can start getting increased hunger. Weight loss, weakness, tiredness, that can happen if you have high blood sugars. Because it's in the blood all over your body, it's also in the blood in the back of your eyes. And so a lot of people have damage to the eyes and therefore get blurred vision because their blood sugars are too high. Numbness and tingling in the feet and hands. Women sometimes get high rates of vaginal infections. So that's one of the first signs sometimes that your blood sugar is high. If you're always going to the pharmacy buying those over-the-counter treatments for candida infections, for vaginal infections, be sure that the next time you go to your doctor, you ask them what your blood sugar is. So that's very common. And a cut that won't heal. So you get a cut on your hands or your feet, and that cut just for some reason doesn't heal. That means that the diabetes, your blood sugar, has affected your immune system. And so you're more predisposed to infections and to cuts not healing as quickly as possible. Hence, COVID-19. That diabetes that you have is affecting your ability of your body's immune system to fight the virus. Now, what causes your blood sugars to rise? Well, there's a number of things. Overeating. If you put on an extra 20, 30 pounds. If you get an infection, that can cause the blood sugar to go up. If you're under physical or emotional stress. If you take certain types of medicines, can make your blood sugar go up. Very commonly, a lot of people out there may be on a drug called prednisone. Prednisone is used for a COPD, for chronic obstructive pulmonary disease. So if you're on a steroid like prednisone, it actually causes your blood sugar to go up. So people that are on those agents with asthma sometimes all of a sudden develop diabetes because they're on that steroid. So there are other agents out there that can actually increase your blood sugar. And then not enough diabetes medicines. Get your blood sugar, it goes up because you're just not on enough medication to get that blood sugar down to where it needs to be. Now, there's something also called hypoglycemia. And we had a question on one of our classes this month where one of the patients said, well, can I go from being hyperglycemic to hypoglycemia? Okay, well, there are certain people out there that just have a diagnosis of hypoglycemia. That has nothing to do with the fact that they have diabetes. Now, people with high blood sugars can experience low blood sugars because they either didn't eat enough food and they have the medications on board, or too much medicine, or too much exercise. It's really important that if you're going to take your medicine and then go out for a jog, that you need to have something on your stomach, some food, or you can get into a low blood sugar reaction while you're exercising. So for those out there who do jogs or exercise, always have a snack with you. And we'll talk about what kinds of things you should carry with you at all times. And then physical or emotional stress. That can also have you have a low blood sugar reaction. Now, what are the signs? You see on this list, we have sweating. Sweating is the number one sign that usually does not go away. There are some signs of low blood sugar that actually go away over time. It's called hypoglycemic unawareness. So this is bad because it means that your blood sugar can start dropping, and the signs that you used to have that your blood sugar is dropping isn't there anymore. Like, for instance, Maybe your heart beating fast used to be a sign, or trembling, or anxiety, or irritability. Sometimes those signs go away over time after you've had diabetes for 5 or 10 years. But if you have sweating as a sign of your low blood sugar reaction, then you will probably continue to always have that sign. And so that's when you know you need to test your blood sugar, try to find out what the number is, and then start all the treatment for low blood sugars. Some other symptoms of low blood sugar can include inability to think clearly, headache, drowsiness, numbness or tingling around the lips, confusion, or coma if it goes on unabated. So you do not want to get to the point where your body shuts down and you become unconscious because your blood sugar is so low. So it's really important that you know your signs of low blood sugar, and everybody's signs are different. Now, what do? How do we treat it? Well, it's called the rule of 15. When you feel like you're low, the first thing I want you to do, if you can, is check your blood sugar to make sure it's low. Then if it is low, and low is usually below 70, around 60, 50, 40. If it's below, down there in that low range, then you need to eat 15 grams of a carbohydrate. You need to wait 15 minutes, check that blood sugar again. If it's still low, you need to repeat the process. So have another 15 grams of carbohydrate. If it's starting to come up, then you need to follow that fast sugar source with a slow carbohydrate source, like a bread, a sandwich with some meat, some protein, so that you're able to keep that blood sugar from dropping again. So fast sugar source, test again. If it's on its way up, slow sugar source. Okay. So what are the fast sugar sources? We need to have you have maybe glucose tablets that you carry with you, maybe glucose gel. I prefer that. Those can be purchased in pharmacies. Or you can just have a half a cup of real orange juice, or a third a cup of real grape juice, or 1.5 to 1 cup of milk, 2 tablespoonfuls of raisins. Raisins are a great snack that you can carry with you in your car or in your purse, so you'll always have it. Or Lifesavers. Lifesavers are easy to carry as well. 3 to 8 pieces of Lifesavers is a fast sugar source. The food that you should not use to treat your low blood sugar is chocolate candy. Okay, you can't use chocolate. Even though it's got sugar in it, it's also got fats. So that slows it down from being a fast sugar source. We don't want you to necessarily use table sugar or candy or syrup or jelly or regular soda or jelly beans unless there's nothing else. Those other things that we mentioned are not available, right? So if they're not available, then you got to use it. But I want you to start really carrying with you the recommended sources for carbohydrate when your blood sugars drop down. Now, there are some people that just have a predisposition. They get these low blood sugar reactions all the time. Usually those are folks that are on insulin, and we haven't gotten their insulin dosing to be perfect yet. So there's something called a glucagon emergency kit. And I recommend all those people that are on insulin that are having trouble with low blood sugars, you should keep this glucagon injection kit around. Because if in fact you become unconscious, you're not going to be able to swallow or chew anything. So we're going to have to give you an injection to get your blood sugar up. So glucagon, we know, increases the blood sugar, and it can actually save your life. It's really important that we're communicating with each other better, that if you live by yourself, that you have a next door neighbor or someone that's close that can help you. Because, there have been a number of celebrities over the years who have died alone. Luther Vandross comes to mind, right? There was no one there. And that's not okay. So we need to be, if you know that your family member or someone in your community or your best friend has diabetes, you need to check on them. Let them know that you're there for them. But more importantly, if you live by yourself, you need some kind of a life alert or some kind of a way that you can contact 911 for help in case you get to a point where you can't get to a telephone. So that's really important. Let's talk about the difference between high and low blood sugars. Okay. The way I find out if my blood sugar is high or low is I do monitoring. I have to use a blood glucose meter and I have to check my blood sugar. So we know that hyperglycemia develops slowly over time, but hypoglycemia can happen in minutes. So that is why it's very serious to have these low blood sugar reactions. So when in doubt, treat it as if it's low blood sugar versus high, and then test as soon as possible. Okay, let's talk a little bit about self-monitoring of blood glucose. I've been doing this for about 40 years. I was there when the very first glucometer came out. You used to have to wash the blood off a strip with a water bottle. We've come a long way, baby, in terms of how good the meters are now. They're so accurate. They're easy to use. It only takes about a few minutes or seconds to be able to get your blood sugar reading. Most of the meters now are seconds, 3 to 6 seconds. You'll know exactly what your blood glucose reading is when you do your finger stick. So again, I encourage everyone out there listening to this that if you have diabetes or prediabetes, you need to get a meter. Now, there are these tests that we use for blood glucose. There are blood tests that are direct methods to tell if your glucose value is high or low. But there are indirect methods called urine testing, where you're testing your urine for ketones. Okay, so what are ketones? Ketones come from the breakdown of fat. And when your body thinks that it's starving because it's not getting that sugar out of the blood into the cell, your body starts to break down fat, and that causes ketone production. And so people who go into comas with high blood sugar, some of them actually have ketones that are present. And ketones are not good, right? We don't want to have your body start breaking down your fat and making ketones. So when you're sick, one of the things that we want you to do is not only test your blood with your blood glucose meter, but we want you to test your urine for ketones. And why is that? Because in some cases, patients are not eating, they're not taking their meds, and they can really get in trouble during that sick day where they have the flu or influenza or other kinds of things. So that's why sick day management is so important. For you all that are out there with diabetes, you need to get some ketone sticks in your home. So when you do, we're about to go into the winter. So when you're getting those symptoms, either from the flu or from now we're in an epidemic, COVID-19, if you're getting symptoms, you need to be sure that you're testing your urine for ketones. So let's talk about monitoring and why it's so critical. So here's a picture that sort of depicts what happens when you eat. So here is the target range is in yellow. And you see that they forgot to take their pill at 8 o'clock in the morning, but they still ate their breakfast. So then they went ahead and they ate, and then they went to work, and then there was an office party at lunch. So they had a little piece of cake, even though they knew they weren't supposed to. And then they went for a walk, and that blood sugar came down. So you can see that you're not taking your meds or taking too much meds, eating foods that you shouldn't eat, but exercise can decrease your blood sugar. All those other things can actually increase your blood sugar. So let's talk about monitoring your diabetes. We talked about the blood glucose monitors that are available in the marketplace. We know that there are methods of glucose testing. So these monitors or blood glucose meters have strips. And these strips, you can read, the meter reads visually. It requires a drop of blood that you put on the strip, and then that meter interprets the amount of sugar that's in that little drop of blood that you put on the strip. The choice of which meter you should buy one that's easy to use, that doesn't cost that much, that has a memory function. And I really like those meters. Now in 2020, everybody should be on a Bluetooth meter so that it's wireless. When you test your sugar, it actually goes up into the cloud, and then you have an app on your phone or your computer where you can actually see your readings and be able to interpret those readings. So I really think at this stage of the game, we're in 2020, everyone needs to be using a Bluetooth meter and working with a healthcare team or Healing Our Village or some other diabetes education program that can help you interpret what your blood glucose is doing. Now, when do I test? Well, if I'm a type 1 diabetic, then I'm usually checking 3 to 4 times a day, before meals and at bedtime. And that's usually, right when I have tell people when to test, we got to do fasting. That first one in the morning after you've been fasting for 8 to 12 hours. Fasting means no food or drink. All right, so with that first urine, that first blood in the morning is probably the most accurate depiction of what's happening with your diabetes. So type 1 people, 3 to 4 times a day, before and after meals, and at bedtime. If you're a type 2, you're generally checking 2 to 3 times per day. If you're out of control, so at least 2 times a day. If you're not at a blood sugar reading that we need you to be at. And what is that number? It's 90 to 130 milligrams per deciliter. When you wake up in the morning, your blood sugar needs to be between 90 and 130 milligrams per deciliter. And any time during the day, your blood sugar should never get above 180. I actually like 160. If you do that, then your hemoglobin A1C, and we're going to talk about that, that's the measure of how well your diabetes is doing. If you do that and you keep that fasting between 90 and 130 and you keep all throughout the day around 160, then your hemoglobin A1C is going to get below 8%, hopefully to our target of 7 to 7.5%. And we'll talk more about that. And testing should be increased every 2 to 3 hours if you're sick. Now, there's some equipment that goes with monitoring. You got your Lancet, you got your test strips, you got your meter. Now the meters I just told you have memory, so you're buying one of those so you don't have to write down necessarily your blood glucose readings in a logbook anymore. And then that data management helps you understand what your pattern of blood sugars are. That's what we do at Healing Our Village. We do something called pattern management. So you gather everything all together. You obtain adequate amount of blood. You wash your hands with warm water. You dangle your arm down to your side. You squeeze below the place where you've pricked your fingers. So I usually recommend that people prick their finger around the edges here, right? And then you start at the bottom of your finger and sort of move it up, put some pressure on it. And if you see that tip of your finger just got a little bit redder, and that is where how you're going to get that little droplet of blood out so that you can now bring the meter and strip to the drop of blood so that you're able to get your blood sugar reading. We don't want you to try to smear the blood on the strip or do any of that. Most of the meters now, you're trying to get the tip of the strip to that blood particle that's on your finger. We don't want you to prick the middle of your finger because that's where most of your nerve endings are. So we want you to prick around the sides so it won't hurt as much. And then once you get that test, you remove the lancet from the lancing device and throw away both the strip and the lancing needle that you used into some kind of a disposable container. It makes sense to know your numbers. You need to know what those numbers are. Fasting, again, 70 to 120, but we really usually shoot for 90 to 130. What's the difference? It's blood versus plasma. So because you're doing a blood test with a blood glucose meter, we're at 90 to 130. And then again, always below 180 is what we want your 2-hour after meal or postprandial goal to be. Tips for monitoring, like I said, in 2020, we need to be using our new apps that are out there, devices that actually can do some pattern management, can store your blood glucose readings. You can use a computer to use graphs and reports. You can bring those reports to your doctor, to your healthcare team, so your doctor knows what's going on with your blood sugar. Use the results to be able to modify your diet modify your exercise plan, but also we at Heal in Our Village use those results to modify what medications you're on, because certain medications work better for certain people. So this is not a one size fits all. And that's one of the big things that I see out there, is that we're not really using the full armamentarium of medications that work by different mechanisms of action to be able to manage diabetes. We're looking at, as I said, for a pattern. What makes your blood sugar go up? Is it rice, or is it the potatoes, or is it the bread? All right. What happens when you go out and get your 10,000 steps in? Does it make your blood sugar go down? So we look at all of that as a pattern, and then we help you structure your lifestyle so that you're going to be in the best position to get to your blood glucose goals that we want you at. And we want you to be careful and keep track of your blood sugars. This is just an example of one of the meters that are out there and what their pattern management looks like. So you can see that there's graphs. You can actually see your blood sugar. You can see when you're above the range and below the range, so that are able to get that very nicely done. Factors that affect your blood glucose levels. We know, of course, the foods that you eat, and also what you drink. One of the things that we tell our patients is to not drink your calories. So everything that you're drinking needs to be 0 calories, because you want to save all your calories for the foods that you eat. Exercising, decreasing your stress, the timing of foods and medications, the time of day the test is performed, all outdated strips, all of those things can affect your blood glucose levels. Now, hemoglobin A1C, we talked about that. That is the test that you use throughout every 2 to 3 months. We want you to do about 2 or 3 hemoglobin A1C tests every year, because we need to know what your number is. Hemoglobin A1C, the goal, the ABA says for that is 7%. Your goal, if you're in your late 50s, 60s, or if you have cardiovascular disease like hypertension, heart failure, coronary artery disease, then I'm a little bit more liberal with the hemoglobin A1C level. So I want you around 7.5%. So hemoglobin A1C is measured in percent. So why do we care if your hemoglobin A1C is higher than 7.5? Well, we care because there's clear data that if you start trending toward 8, 9, 10%, you're causing damage to your eyes, to your kidneys, to your nerves, to your vessels, and to your heart. And so we need to have your blood sugar as close to normal, which is usually 4 to 6 milligrams per deciliter. We want you to be as close to normal as possible. So hemoglobin A1C, again, is in percent. When you don't have diabetes, your A1C is generally 4 to 6%. And so that's what we're trying to do, is get you as close to normal as possible. Now, let's look at what hemoglobin A1C looks like. So hemoglobin, you've probably heard of that. Hemoglobin is what carries oxygen throughout the body. Well, there are different components to the hemoglobin molecule. And one of the components is the A1C component of the hemoglobin. Hemoglobin is in the red blood cell. So what we found is that if your blood sugar is high, that glucose attaches to the A1C part of the hemoglobin molecule. And so and that blood cell only lasts for 120 days. So that is why we want you to get an A1C level every 3 months or so we can see what your blood sugar has been over that 3-month period of time. And if the A1C is low, then I know your blood sugars have been not low. But if that A1C is high, then we know those blood sugars have been high. So this is a good picture that sort of shows you that. So you see all the little white specks there, that's the glucose, and you see how it's attaching to that red blood cell, right? So that you can see that that number would be up in those patients. So a lot of times back in the good old days, we used to have people write down their blood sugars. I'm so happy now that we have memory in our meters, so I don't have to count on you to write down your numbers, because we know sometimes you didn't write them down accurately. And so now it's hard to cheat out there if you have one of those blood glucose meters that has memory. So when you're looking at the relationship between the A1C value and your blood sugar. This chart, I think, is a good chart. So you can see that if your A1C out there, for instance, is at 9%, then that means if you look at all your highs and all your lows of your blood sugars in that 24-hour period, it's about 215. That's what your blood sugar is. All the highs and all the lows. So the mean blood sugar, if your A1C is at 9%, is 215. Now, I just told you I want you to be 90 to 130 in the morning, and I want you to never get above 180, 160. So you can see that 215 is too high. So in order to be able to get in that good control area, you see that you need to be down to an A1C of 6 to 7. Okay? And that's very important. So, and if you're at 7, that means your mean blood sugar is about 150. And if you're at 8, it means your mean blood sugar is 180. So all of you out there that have 9, 10, 11, 12, 15, the highest I've ever seen is 25. But I'm sure there are folks out there that have seen higher than that in terms of their A1C levels. So we got to get down so that these numbers are much better. And A1C and measuring it on a regular basis can help us do that. So at this point, this is where this program ends. We're going to pick it up next time so that we're able to talk a little bit more about what is diabetes, how you treat it, what are the complications, and over the next series of weeks, you'll be able to learn everything you wanted to know about diabetes. Again, I'm Dr. Lenore Coleman, president and founder of Healing Our Village. A lot of this information is up on our websites. We have a new website called hovhealth.com. We have videos on there, some talk shows on there. There's lots of information that you can get. Join our social media pages, our Facebook, our Instagram, our YouTube channels. There are videos about diabetes up on our YouTube channel, and we encourage all of you to learn as much as you can in order to keep your diabetes under control. Our hashtag is no more funerals.